all
screwed.
hard time.
Literally.
Hey, Chris Grayman, I am here with Dr. Razi. We talked to you a little earlier about introducing Dr. D and Dr. Razi. Dr. Razi teaches at UCLA, and he's actually putting an implant in me. He already has the expander, and he's going to tell you all the terminology. Bottom line, this didn't even hurt. This is less than, I'd rather do this than get my teeth clean. So can you explain kind of what you did? And I'm still dumbfounded by this picture of this screw that's in my mouth, and I'm pretty amazed. And then like technology, can you do a little bit?
Oh, sure. Well, his implant is not because he didn't take care of a tooth and he lost a tooth. His implant is because he's congenitally missing a tooth. So because there was no tooth in there at all, there's not enough bone. And it is on the lower jaw, and adding bone to the lower jaw is not that easy. So we're using a new system and new technology. Instead of adding bone from outside, you're expanding from inside. So rather than drilling, you're expanding the little bone that he has, which is not little, it's enough because he works out. We were joking around earlier about it. But we're expanding it out. So that's what he's talking about, expanders. And then the X-ray shows the second set of expander that I did in there. And with that, we'll check the angulation with the size. We make sure we are completely away from the nerves that are very important not to be cut. And we didn't even give him the kind of numbness that we give, and you see people talk while half of their face is drooling. He's not getting that. He just got a little infiltration around it because we want the nerves to be alive. In case we get close to them, we want him to feel it. So right now he's got the expander in there. I'm going to go ahead. This was the last expander. Dr. Dorschlag already came, and he's the restorative dentist that is going to put the crown on it. He approved where exactly this implant is going to be, is where he wants him to be. So I'm going to take the expander out and place the final implant, and that's basically it.
And no pain. Seriously, I haven't even twitched. And I'm a wimp when it comes to this stuff. So, again, this is Dr. Razi in Valencia, Dr. D in Valencia, and we'll talk more later.
You can come and take shots from here, expanders and all that. Maybe you can put it in there.
I can't see your hands in the way. There we go.
Come forward. I might just from this back angle.
On the mesial of 9.
Money.
Manny. Can you see it?
Reality dentistry.
Well, we're gonna ask you to come and check it again, Dr. D. You're such a good patient.
Ow, ow. Just kidding. Didn't hurt. This is kind of embarrassing, but it's cool.
Oh, you're such a cool guy. You have no problem getting screwed in public, huh?
Uh-huh.
I'm going to do a 3.7 by 10.
I thought we were just gonna shoot the first part, but this is cool. I'm cool.
Oh, you didn't want me to shoot the whole thing?
Oh, it's too late now.
Well, you could always
But I
edit
can
He
it.
has to edit.
I don't edit. I do everything raw.
Oh,
I'm
really?
a raw. I'm a
Oh,
raw
yeah.
guy.
Is-
If I'm getting screwed, it's raw. It's just everything's raw. I
Is this
like it.
accurate that he's doing the interview for his own implant? This
Yeah,
might
he
be a
is.
first.
That's
Yeah.
Dr. D, as you guys remember. He's the main man,
Say hi, Dr. D.
co-main man. Sorry. It's
My
like
best
the-
of all.
It's like the duo. All right.
Oh, we work together.
That was a good face.
Okay.
Thanks,
so
I want
this
funny faces. Is this the implant?
This is the implant, but before we do the implant, I'm going to actually go ahead and disinfect everything with a laser.
One thing about the implant, the quality of the implant matters because people a lot of times will see an implant for $7.99. I personally wouldn't want a implant that you didn't pay a lot of money for because it's a morgue, right?
Well, it's the company who supports it, and the implants that we get lifetime warranty on. So that means the implant company would replace it lifetime if anything happens to it.
And it's
And
titanium or?
That's titanium. Oh, all the implants are titanium.
Okay.
It's the technique that we use that is different. It's the design of the implant as well.
Okay.
The design that we're using is from a very reputable Swedish company. The same design has been in use for the last 22 years, and it's been proven every other company now is using that now.
Okay.
We're using what we call an internal hex. We're using what we call a conical seal, and we're using what we call a platform switch. That's for the dentist out there. And those are the best of what we have out there to make sure that the longevity is lifetime. So you get a lifetime warranty from me as well on this implant, but that is my lifetime, not your lifetime.
Yep.
So yeah, there's a lot of prayers from me out there, 'cause I got at least a couple thousand of these out there. So this laser disinfects and also biosimulates the bone. So when we place the implant, it's here's what's gonna go there.
Sorry, Manny.
It's okay.
I'm gonna feel a little pressure at the end. Let's have the hand torque. And that's it, basically, or
You're serious?
that's it.
I swear on my daughter, on her, the videographer, that didn't hurt at all.
Great.
Now shut it off.
We're used to